show is starting now. Good evening, everybody. Welcome to the coronavirus update show. My name is Omari Salisbury. I'm joined by producer extraordinaire Nikki Barron for episode number 3 now, right?
Yep, this is our third episode.
Man, yeah, and unfortunately, the news of coronavirus is still out there. And Nikki has committed herself to bringing information here to the community, getting the best information out there, and also not only just around the science, even though I know today is kind of science oriented, but about the way the coronavirus is impacting our community in general. You know, things from unemployment, transportation, education, and some of everything else. And yeah, all that being said, Nikki, I hand it over to you. I think where you're starting today with the numbers.
Let's start with the numbers. So they update these in the evening. So these are the most updated numbers as of, let's see what it said, as of about 3:30 today. So our confirmed cases are 165,000. Confirmed cases in the state of Washington. Hospitalizations are up to 10,895. Deaths are up to 2,774. And the number that I am always keeping my eyes on, which is our positivity rates, right now are, let's see, give me this number. We are at 10.8 positivity rate, which means that about 10, a little over almost 11% of the tests that they're doing in the state of Washington are coming back positive. And for reference, our benchmark, our goal that we're shooting for is 2% or less to have, any sort of normalcy. We'd still be wearing masks and everything at 2%, but it wouldn't be in this full lockdown, basically, that we're in right now. So it's not looking good for us here in Washington State.
So I'm just assuming here, based upon like other news reports and everything else, but what people are kind of saying, these experts that are out there, is that like as bad as things might be right now, that we might want to prepare for things to be worse based upon travel patterns around the holiday?
Yeah, so we still saw about 50% year over year as far as travelers, at least in airports. So we still had millions of people moving around the country last week. And Cairo actually did a story on this a couple weeks ago where they actually had 2 people who actually got COVID on a flight from Denver to Seattle. And it's not like these, the airlines tell you, oh, things are safe. And, we've got all these like high tech systems that clean the air. They really don't. And there's not a lot of science to back that up. And there's also not a lot of support behind contact tracing on flights. So kind of the core of the story that Cairo did was that these 2 people both contacted the airlines, and none of the airlines the airline that they contacted didn't have anything in place as far as contact tracing goes. They essentially said, well, public health will have to reach out to the CDC, who are in the airport, who then they will get the flight manifest, and then they will do the contact tracing. But the people who are supposed to be handling that aspect of contact tracing are so far behind that people would have already spread it throughout their communities. They're weeks behind. So it doesn't really do any good to get contact tracing weeks or months after you're on a flight. So it's not the best place to be on an airplane right now.
Right. And you said that hospitalizations continue to increase, huh? I mean, ultimately, you get to a point, if hospitalizations increase, that hospitals run out of space.
Yeah, so they've already converted all of their they've already converted like surgery, like care, like aftercare for surgery and other areas of the hospital that are not normally allocated to ICU into ICU beds to prepare for this surge, because the way that the numbers are coming out, we're looking at, hospitalizations, upwards of 150 people being hospitalized every single day in the state of Washington. So they're already stopping elective surgeries. It's it's just a story that I read, but a friend was posting today online about how their friend tried to go in to get treatment for something that was non-emergency, and they were turned away because the risk of so many COVID patients in the hospital was so high. They didn't feel that the care that they would get was with the risk of exposure. And then there's just not doctors in space. And so they're already starting to try to like make those accommodations in the hospital system here in Washington State to accommodate this influx of hospitalizations.
Right, and I guess the other thing is as well as personnel, actually,
Yeah.
doctors and nurses.
Yeah, so I want to say 500 nurses actually came together to urge King County to put stricter lockdowns in place and to urge people in the city to stay home, mask up, and wash their hands because they're exhausted. There's not enough healthcare workers to fight this, and in Washington State, and then they're tired. They've worked up, they're working double, sometimes triple the amount of hours that they normally do. And they're also getting sick at a higher rate than the average Washingtonian. So, they're really urging people to stay home, mask up, wash your hands. So,
Real deal. All right, so I know we're going to take a short break here. Before we do, when we come back on the other side with your guest, maybe you can tell us a little bit about your guest who's joining us tonight.
Yes, so we've actually had Crystal Fincher on before in her professional capacity as a political analyst and reporter, but we follow her on Twitter, and I noticed that she had signed up to join a vaccine trial, which was one of the topics I was hoping to cover on the show, because I know I'm a little bit scared of being in a first round of a vaccine. And I know that historically the Black community is very distrustful of vaccines, especially trials and things like this. So I'm really excited to have this opportunity to ask her, why she chose to do this, how it's been, how it works, kind of the mechanics of it. And I don't know, maybe quell some of my own fears about it, and maybe we can help get more people of color to join the study, because I know that that's something that a lot of vaccine studies are struggling with right now, and that's getting a bigger variety of the types of people that they need to actually make sure that this is safe. They need a wide variety of people. So
all right, well, we're going to see what Crystal Fincher has to say. I know in certain communities, not all Black people, but in certain communities, the Black community, that's a heavy lift. You're talking about us going and testing a vaccine. We're going to take a short break. When we come right back. On the other side, we have Crystal Fincher. Welcome back to the Coronavirus Update Show. My name is Omari, Salisbury, joined by my colleague Nikki, Barron, and also we have Crystal Fincher. Hey, Crystal.
Hey, how's it going?
Doing good. Now I know Nikki. She has all these questions for you. Go ahead, fire away, Nikki.
Hi, Crystal. Why don't we start by just having you introduce yourself for those that didn't catch you on our political analysis show.
Hi, I'm Crystal Fincher. By day, I'm a political consultant. I work on political campaigns, ballot campaigns, independent expenditure campaigns up and down the West Coast. So that's what I've done for the past 10 years. But I'm also, just living in the middle of this pandemic like everyone else. And we got connected, specifically Nikki and I, because I joined a COVID vaccine trial.
So what made you want to join this trial?
a recognition that issues of racism are hitting my community, the Black community, particularly hard. I also live in Kent, which in South King County, across the county, Kent, Auburn, SeaTac, Tukwila are also hit the hardest in the county. So they're affecting the communities I'm in harder, but also those issues make that problem harder to solve. And so when we're talking about vaccines or other issues, specifically with vaccines and the treatment of this or prevention of this, there is a lot of mistrust in the Black community about trials and doctors, and justifiably so. Because of that, getting good data on how our bodies react to vaccines, which may be different for any number of reasons than how the average white person may react to vaccines, and what issues they're seeing or how they react or combine with existing comorbidities that may be more prevalent or less prevalent in different populations, that it's going to be harder to recruit people in the Black community because of the distrust that has been built up because of the unethical and evil experimentation that's happened over the years. People talk about the Tuskegee experimentation, how horrible that was, but it goes so far beyond that. I mean, into the 90s, where they were experimenting on Black children unethically. So there's a long history of people hearing trial and thinking, oh, okay, that's where they have used and abused us and mistreated us, and I'm not signing up for that. But that also prevents us from getting good information about how to, whether this is safe for us to use in our community. So I just figured, given those challenges, that if I'm able to be one of the people who's like, okay, it's not like I think this is, 100% smooth sailing necessarily, but we do need this data for our community to be safe because it's hitting us so hard.
And so how does being in a vaccine trial actually work?
So I saw the trial advertised on the news, went to the website, signed up, didn't know if I was going to hear back or not. But within a couple of weeks, I just got an email saying, hey, we're enrolling for the trial. And so there was a website with a bunch of health screening questions. It probably took about 10 minutes to go through. It asked about, existing conditions that you had, your kind of health history, where you were at, what your current lifestyle is. Do you come into contact with a lot of people, that kind of stuff. Submitted that. And then probably a week following that, I got an email saying that they were accepting people into the trial and scheduling times to come in. I went in last Monday, and it was a 3-hour intake, first kind of meeting where a large part of that was really explaining and talking through, what this vaccine is, talking through the trial, what's involved with it, going through all of the disclaimers, rights and responsibilities and what everything is with this trial, and what they'd be asking of me, going through questions. And I certainly had a number of questions. And then they took some blood. So they have information to start with. I got the vaccine and then was done with it. And then a week, couple days following, there was a little phone interview on if I was experiencing any of the symptoms that they'd previously talked about, or that, could have anything to do with getting a new vaccine. And then there's an app that comes along with it that kind of asks you weekly questions about symptoms to start off. This is a 2-shot vaccine. So there's another shot that I'll be getting a month after the first one. So near the end of December. And then after that, it's just a series of check-ins. Mostly if I do come down with COVID symptoms, I'm to call them, they'll screen me, they'll do testing. And then over the next 2 years, there are, I believe 4 times that I go in just for blood work, and they'll be looking for different markers of if you've built up immunity, if you have antibodies in your system, checking for different markers of infection and the effects of the vaccine. So just going through that whole process. So I'm on the very front end. I have not experienced any symptoms so far. They talked about, just what this vaccine is, and it's done in a kind of a traditional way that most vaccines are constructed, which is traditionally a very safe way. So that didn't give me too many concerns. And this is a double-blind trial, meaning that some people get the vaccine and some people get a placebo, which in the United States trial is just saline. So there's a 2-to-1 chance of receiving the vaccine to a placebo. And they do that so that, someone might be like, oh, my arm hurts, I'm experiencing an adverse side effect that may not be related to the vaccine. And so injecting people with what they think could be, but tracking who actually does and who doesn't, with us not knowing, allows them to determine, okay, these side effects are not related to the vaccine because this person didn't get the actual vaccine, it was just a placebo. So it allows them to pinpoint exactly what issues or symptoms may be related, or if they see a benefit, that benefit was specifically tied to the group that received the actual vaccine and not the group that received the placebo or a fake vaccine.
Wow, I didn't realize it's that long of a process that you'll for years be part of this. I guess I figured like once the vaccine was widely available, it would be, it'd be like, oh, you're done. Do you ever find out if you actually got it or not, like at the end of it? Or because if because if it becomes widely available, you want to be able to go get it, right?
Right. So that was one of the things that they talked about. I don't know how they're handling other trials. This is an AstraZeneca trial that I'm in. For this one, they did say, hey, if another vaccine comes out and you feel that you need to get it, you can go ahead and get that. We still want to track results because, like you said, this all feels very fast and like, hey, the vaccine's almost here, we're going to get it. But we really still are on the very beginning part of understanding everything that this, that COVID is and all of the issues associated with treating it. We don't know what long-term effects are. We won't know if this is like, if it offers short-term immunity or long-term. There's still questions about, does this stop you from getting sick, or does it actually stop you from being able to transmit it, which are two different issues that they're studying. So there's still a lot to be learned over time. So this is a lengthy trial. And so there's just a lot to figure out with that. And there is also a financial stipend. I think to start off, it was $175 total. And then there's, I think every successive trip is like $70-ish that you go in, I believe. So there is some compensation. I think the compensation probably does not ease a lot of concerns for people because they're like, well, hey, if this can mess up my long-term health, that really doesn't matter if they're giving me $175 for it. But they do provide a stipend for the time and travel associated with it.
Yeah.
Did you have any questions, O?
Yeah, well, just more of a comment because we on the morning update show last week we talked about I think it was the New York Times or Washington Post. They put out an article that said the majority of black people said that they wouldn't take the vaccine even if it was free, and also a big majority of Hispanic population. And it's like we get caught in these catch-22s where it's like there's a good historical reason not to be trusting of a vaccine, but then like you see things that the future of this might be, for example, like international travel. You gotta, it's gonna be a vaccine passport. Somebody like me, I travel a lot, so it's like you're faced with these dilemmas, and then you don't even know, like so many of us are essential workers. You don't know what in the coming year or two what that's going to look like as to be able to like hold a job or to access this or that, or around this vaccine, and so it puts us in a dilemma that a lot of people, and it was real interesting because, a lot of people watch the morning update show beyond our community. We get a lot of white people who watch the morning update show and they want to like learn and know what's up. And it was mind blowing. For some of them, they were like, man, why wouldn't you guys want the vaccine? But then I played a 4-minute segment about the history around the Tuskegee experiment and things like that. And it's not imagined, and I was comparing to like there's people right now who are like, they're not going to get the vaccine because they don't trust the Trump administration, or they're not going to get the vaccine because of this, or it might have been too fast or whatever. There's a whole different group of people like us who are like, nah, this is something that's happened here. And I think that, I want to commend you for, like stepping out there and putting in mind that, like, man, somebody needs to be able to try to get this data around people in our community and everything else. I don't know in the same shoes if I would go and get the vaccine, so I'm glad that you did. But I just want to acknowledge that, though, because it really is going against the grain in general in our community.
Well, and it's absolutely valid. And like you said, there is data behind it. There are concrete reasons, historical reasons, and a lot of trials, oftentimes also backed up by personal experiences within the healthcare system. I mean, we talk about the disparity between white and Black infant mortality rates and maternal mortality rates, and they're horrible in the Black community. And that's not just because of comorbidities or access to healthcare. It's about the treatment that's received in the system. When I gave birth, a doctor asked a nurse if they had drug tested me. There was no reason to do that. They felt like they should do that anyway for some reason. I don't talk to a lot of people outside of the Black community who have that experience for no reason. So similar to like the policing conversation, where we know what there's lots of data out there, but we also have our own experiences just in treatment today within our healthcare system that presents that as an unfriendly place to go, and we know a lot of people who are just hesitant to go to the doctor because of previous mistreatment that they've received in the system. So there's a ton of that. But we also need to get data on how this affects our community for the people who are going to be getting it. So it's those challenges.
Right. I remember we had Dr. Mook, who's the biochemist out there at the UW, actually working on some of this research out there, the hip hop biochemist. And one thing that he really hits home is that a lot of people outside of our community might not understand or be able to relate with is the empathy gap in healthcare. The empathy, it's assumed that a Black woman's tolerance to pain is much higher than a white woman's. And, there's so many things around inequity around the health system, and that empathy gap is real and big, and impacts our community in a crazy way. And so like I said, I think this is dope because like you taking this trial even opens up this conversation for us to be having tonight, which is an important conversation about real important issues that really we don't discuss a lot in our community.
Well, I appreciate that. I just think it is important to be talking about these issues. It is important to, also for those involved in the healthcare system to understand that and to take measures to, I don't know if atone is the right word, but to factor that into how they're operating, and to see, to do what they can to, one, make sure that they're dealing with their own biases and biases within their treatment, which have been well documented and are acknowledged by, and there's a ton of medical research that you can read in peer-reviewed journals right now that covers it all. This isn't speculation. Or just anecdotal. This is just fact. So, we just need to see how this plays out. And we need to have people who say, I did it and I'm okay. And I'm hoping to be one of those people who can say, I did it and I'm okay, because it's going to take a number of us being able to say that and people seeing us be okay, potentially for a while before they do it. But the risks of this are just really real for our community. So we have to have multiple fronts to attack this.
Agreed.
Thank you so much, Crystal. Do you have any final words about being a part of this that you want to make sure that our listeners take away from here?
Well, I would say this trial is being administered through the Fred Hutch Center, so they're doing good work. I was encouraged by the way I was treated and their ability to just take a lot of time and talk through all the issues. I was always, given as much freedom as I wanted to ask questions or to opt out in any time, be like, you know what, this isn't right for me. They were like, hey, if you don't agree, if you aren't comfortable with that, you don't have to do that. There are some optional things about it that they're like, you can opt into this part or opt out. And so if you're interested in that, I would just, there are lots of news stories on it, or contact the Fred Hutchinson Research Center and see if you'd be willing to do that. But more people are needed. They're still recruiting, for this trial and for several other trials. But it is, we don't get data without people doing it. And usually it doesn't get to the stage where they're actually doing it on a lot of people until it's been tested and proven to be safe on, for the metrics that they have before. So it doesn't feel very risky for me. Everyone's going to have to assess their own feeling about that. But if you think it might be something that you're willing to do, I would certainly look into it and talk to them about it.
Thank you so much for being a part of this vaccine trial and for your time today.
Thank you.
Thank you. Man, this is interesting. Like I said, Crystal Fincher, she's brave.
She's so brave. I'm still hesitant. It's still like a scary thing for me to consider being, part of a science experiment. But I think it's great that she's doing it. And I actually feel a lot more comfortable after hearing about her experience. So what used to be a no, never going to happen is a maybe.
Well, in talking around the office here, I think people in their life journey have done things more risky and survived.
I definitely probably have. Yeah.
People might have done one or two things way more riskier than the vaccine trial, and they live to tell about it. So we'll see.
That's definitely true.
So next coronavirus update show is Wednesday at 6:15 p.m. Tell us what's going on that show.
Yeah, so I am going to be speaking with our friends over at Neighbor Care to talk about pandemic fatigue, mental health in the pandemic, surrounding not only dealing with the trauma of, seeing our friends, neighbors, community members, not making it through this pandemic, but also this, the idea that I think drives a lot of people to maybe think it's a conspiracy or, drive people to take risks, not wear their masks, gather in groups. And it's this idea of pandemic fatigue. So we'll actually be talking to a mental health expert with our friends at Neighbor Care about all of this. And we'll have this for you 6:15 on Wednesday. And you can always catch all the past episodes on any streaming platform if you prefer the podcast, or you can just head to our website, whereweconverge.com, and you will find our COVID-19 resources page. And that is where you find all the video episodes of this show.
All right. Well, before we get out of here, I want to again commend you on your commitment around producing this show and staying on top of these numbers, and committing yourself to be the bearer of bad news, at least for now. Hopefully, as this goes on, you'll be the bearer of good news as we finally turn the corner on it. But thank you. You know what I'm saying? Thank you for being committed to getting information out to our community.
I love being able to support the community this way. It's hard to be the person to go, 35 people passed away this weekend. And then, I instantly think about 35 people I know. And that just feels like so many people. So that part is really hard. But at the same time, I think it's important work and I'm proud to do it. And so thank you for appreciating me. I think it's important work. So totally worth it. And, maybe I'll get some good techniques outside of just knitting and skateboarding, which is kind of how I deal with it now. On our next episode with the mental health expert.
Yeah, people comment on that knitting too, by the way. I don't know if you see it in the comments.
Yeah, I do. And I'm like, if only you saw the backside,
All right, we're going to get out of here. So next coronavirus update show is Wednesday at 6:15 p.m. And people can catch us both tomorrow morning, 11 a.m. on the Morning Update show. And until then, I'll say bye.
Bye.